While right-wing media outlets like Fox News have been pushing an anti-vaccine narrative for months now, what's been getting less attention is they keep pushing for alternative and experimental remedies for the virus.
We know that we have therapeutics such as inhaled steroids, azithromycin, simple over-the-counter meds like vitamin D3 and zinc that also boost our immune systems. And we know that our FDA has in many ways failed us by not allowing for the use of ivermectin and hydroxychloroquine, both of which are used around the world to reduce COVID hospitalizations and deaths.
So just to be clear, there's really zero clinical evidence that hydroxychloroquine, the malaria drug that all the folks at Fox News and the president were obsessed with, has any benefit whatsoever. But I want to highlight one of the other drugs that Laura Ingraham touted there called ivermectin. She's had guests come on her show and promote the drug as an effective treatment to COVID, even though the FDA has warned against its use. And again, the FDA sometimes makes mistakes, but if you're promoting a treatment, you got to be very careful. I mean, at least I feel like I do with my responsibility in this job. Well, yesterday, a study supporting ivermectin as a treatment for COVID was withdrawn over, quote, ethical concerns. Well, the website that hosted the study did not exactly identify its concerns with it. The Guardian reported the introduction section of the paper appeared to have been almost entirely plagiarized. That is just one example of the vast ocean of dodgy information out there. There is a lot, and it's part of the huge problem that we've been living with for months, over a year. Yesterday, the White House singled out Facebook for not doing enough to stop the spread of lies about COVID and vaccines. Today, President Biden took a step further.
On COVID misinformation, what's your message to platforms like Facebook?
They're killing people. I mean, look, the only pandemic we have is among the unvaccinated. And they're killing people.
Facebook responded with a statement saying, quote, "We will not be distracted by accusations which aren't supported by the facts. The fact is that more than 2 billion people have viewed authoritative information about COVID-19 and vaccines on Facebook, which is more than any other place on the internet. More than 3.3 million Americans have used our vaccine finder tool to find out where and how to get a vaccine. The facts show Facebook is helping save lives, period." 3.3 million Americans out of hundreds of millions of shots is maybe not great. It's also not clear exactly how many people saw the COVID lies on Facebook. It's a big platform. They're seeing a lot of stuff. But the company has removed more than 18 million misleading posts from Facebook and Instagram since the start of the pandemic. When it comes to the dangers of not getting a vaccine, well, President Biden is absolutely, indisputably correct on that right now, the only pandemic we have is among the unvaccinated. In a new piece in The Atlantic about the recent surge of COVID cases in Missouri, Pulitzer Prize-winning science reporter Ed Yong writes, quote, "Almost every COVID-19 patient in Springfield's hospitals is unvaccinated, and the dozen or so exceptions are all either elderly or immunocompromised people. The vaccines are working as intended, but the number of people who refuse to get their shots is crushing morale." Ed Yong, who's a Pulitzer Prize-winning staff writer for The Atlantic, joins me now. Ed, this piece was tough reading, but important. Tell us just a little bit about where this area is and what you heard from the healthcare workers who are working there.
So Springfield is a city in the southwest of Missouri. It's currently the epicenter of the state's massive COVID outbreak. One of the major hospitals there has acquired as many patients in the last 5 weeks as it did in 5 months last year, a testament to how quickly the Delta variant can spread among unvaccinated people. The vast majority of people who are falling sick with COVID in Springfield are unvaccinated. And unlike last year, a lot of them are younger. They're in their 20s, 30s, 40s. And people who these doctors and nurses are seeing in their 30s this year in their ICUs seem to be much sicker than that same age group last year.
We should note that it's a little unclear right now in terms of our understanding the evidence of Delta. We know quite certainly it's more transmissible. It's unclear whether it gets people sicker, but what your reporting indicates, just from the sort of anecdotal experience of the people working in these hospitals, they feel like that's what they're seeing. Is that a correct characterization?
Yeah, there's definitely controversy around whether Delta is deadlier, but all I've heard consistently from doctors and nurses is that people seem to be not only younger, but also sicker this year. And there might be various reasons for that. But the ultimate result is that healthcare workers are struggling. They're really exhausted. They're overwhelmed again. And they're just indignant that at a time when we have vaccines, plural, that are incredibly effective, they're having to go through all of this again. They're having to work ridiculous shifts. They're having to, zip up many body bags a day. They're losing patients, and they shouldn't be. They're outraged and just sad and frustrated that this is where we are. It shouldn't be that way. 1.5 years on.
You report one nurse being spat at by a patient when she communicated that he was COVID positive. There's a lot of skepticism among folks coming in that the thing is real or that they actually have it.
Yeah, a lot of people seem to be resistant to the reality of the pandemic and the usefulness of the vaccines, even to the quite literally bitter end. A lot of others change their minds. People suddenly realize the mistakes they've made or the misinformation they've listened to. But often it's too late. Like if you get at the point where you are sick enough to warrant hospitalization, to enter an ICU, there's not a lot doctors can do. They can provide basic medical care, but the treatments available, contrary to what Fox News might say, are just not very good. So the best chance of surviving is to not even get infected in the first place. And the best way of doing that at the moment is to get vaccinated. But in Springfield, in that county, about only 40% of people have been vaccinated. And in some of the surrounding counties, it's in the teens. And this is what happens when you have a largely unvaccinated population that has Delta ripping through it. You're going to overwhelm hospitals, and you're going to wear out the healthcare workers who were so lauded as heroes last year. They're burning out now.
The only small hope I have in all this is that we saw in the previous iterations of the outbreak, even places that were resistant to sort of masking or social distancing, like Arizona last summer, when the numbers start to go up, people do change their behavior. They do. They stop being less mobile. We see it in cell phone data, driving data. Jeff Zients had this to say, saying that states with the highest case rates are seeing their vaccination rates go up. In fact, in the past week, the 5 states with the highest case rates, Arkansas, Florida, Louisiana, Missouri, Nevada, had a higher rate of people getting newly vaccinated than the national average. One wonders, or at least hopes, that maybe this will change some incentives and behavior.
Indeed. Some of the public health workers who I spoke to in Springfield, who, by the way, are doing an admirable job with very few resources and not enough staff, are a little optimistic, cautiously so, that they've seen signs of change, that their attempts to talk to the communities and go through churches and so on are bearing fruit. But building trust with people is slow. Delta is really fast.
That's the problem. Ed Yong, as always, great reporting, and thanks for sharing it with us this evening.